Hi, my name is Lily Reich. I am the CEO of the Pritzker School of Medicine at the University of Chicago. I am also a wearable device expert, and I called for this meeting because it is urgent, and I really need to discuss, we all need to discuss the importance of patient engagement in healthcare outcomes in a hospitalized setting and outside hospitalized settings. I want to just, thank you, Willa, Justin, and Preet for all coming today. I know this was very last minute, but I'm very glad you could come. So, just first off, I want to define what is patient engagement. It's a very broad definition. Many people have their own interpretations of that terminology. But in my view, patient engagement is when the healthcare provider and the patient come together to decide which is the best care, plan of action for their health. Many patients today, a number of them would like to take initiative of their own health because it allows more autonomy in the hospital setting for the patient. So they can take more charge of their, their health choices and their lifestyle. But specifically though, I'm interested in digital healthcare innovation, particularly wearable devices. There is a technology called DPART that is available on the Apple Watch and Fitbit. Patients can easily wear it and keep track of their health, and it can also be uploaded into the EHR. DPART will predict decrease for risks in cardiovascular disease, future heart attacks, diabetes. Did you know that the average 3-day hospitalized stay will cost up to $30,000? That is a huge number. The average income for a U.S. Citizen is around $60,000 max. So if we can bring those costs down, we can decrease hospitalized stays, have lower costs in patient diabetes and future heart attacks. Justin, take it away.
Yeah, I think this would be a good time for me to step in here as the Chief Medical Officer of this fine institution. I need to bring up, this crisis of patient engagement at the clinical setting specifically. We need to keep up with the times, with all the research supporting patient engagement today, we really must make changes to our workflow. Did you know that 93% of physicians feel that mobile health platforms can boost a patient's healthcare outcome?
Whoa, that's a lot.
Yeah, these devices can really change the way patients interface with their own health to improve their own individual outcomes. As an example, a patient can present to their PCP and go through a battery of tests, have the physician work through a laundry list of differential diagnoses, and come up with a well-constructed diagnosis with a simple treatment plan such as taking one pill every day. However, patients have been found to be non-compliant to medications up to 50% of the time. This not only hurts the patient by not providing them with needed medication, but it may also confuse the provider if they don't realize the patient wasn't taking the medication as prescribed, and maybe the provider then determines, the patient needs a higher dosage of this medication and can cause an injury to the patient. You can imagine how bad this might get. A simple text message to patients has been shown to increase medication adherence by 17.8%, which is an incredible amount when you're talking about healthcare outcomes. Incorporating this data into a mobile device or app such as DPART that can track when patients are taking medications will not only improve patient medication adherence, but when patients present to hospitals and are either unsure of their medications or too sick to respond, providers can then access their medication history through this app to clarify the clinical picture and avoid medical errors.
Yeah, but whoa there, Mr. Chief Medical Officer. Can't just let any hospital employee have access to these records. And I didn't hear you mention anything about a business associate agreement.
No, you're right, of course. So the link between the mobile app and hospital will need to adhere to HIPAA regulations and certainly require a business associate agreement in order to transmit data between the app and hospital if they are separate entities. But back to the patients and improving their outcomes. We're talking about a way to avoid giving patients medications they're allergic to. We're talking about being able to know if a patient's elevated heart rate is due to illness or because they stopped taking their beta blocker. Right now, patient usage of these apps is only 2%. Yes, 2%, which means we've only even begun to scratch the surface of what could be potentially added to patient outcomes with the use of these apps.
Yeah, but that sounds expensive. Can our hospital afford this?
You know what? On the contrary, our hospital really can't afford not to do this. Estimates currently show that the 2% patient adoption rate we have today could cost the hospital more than $100 million in lost revenue every single year. We're talking about something that can change healthcare as we know it. Patients using an online portal were even found to be more likely to undergo preventative and screening services. The ability to connect to patients 24/7 allows us to not only improve engagement but also outcomes, which is why we're all here today.
Yeah, agree. So as the leader of our project management department in our hospital, I have something to discuss about the patient engagement after their hospital discharge. So as you know, our hospital provides a patient-centered program to keep their recovery on track after they meet their doctors. And at this stage, facing disease can be really lonely and desperate for a person. We always met some patients that feels like they are labeled by their disease, like obesity and diabetes. Even their doctors don't know where their disease will be an end. So the doctors just tell them like, you need to persist in doing exercises, you can't eat any sugar, and you have to take medicine every day at certain times. But maybe they didn't know what their medicine is. So it's hard to imagine, it's not hard to imagine why the patient always losing enthusiasm to fighting with their disease. So our team just made so much effort to boost patient engagement. We currently have our professional teams of doctors and nurses, even psychologists, to provide the home care and regular consulting to meet our patient at their home in the time they are comfortable with. And we have our scientists and the researchers team who build our own applications that can integrate the clinical data and send reminders to a patient when they need to take their medicine and when they need to perform their therapeutic exercises. So what we are going to do in the future is actually keep interacting with our patients through the technology, through big data analysis. For example, we may know that there are some algorithms in a gamble game can predict your chance of win based on each step you make in a certain game. And the analogy in healthcare is that you can use a bunch of biological data to make predictions of the disease occurrence, which is unique and individual. So it will alert you at certain time when your possibility of getting a disease goes up. Can I ask you a question?
Of course.
When
Sure.
did you go sleep yesterday?
I went to bed around midnight.
I went to bed around midnight as well.
3 a.m.
Me too, 3 a.m. So we all have procrastinations, and maybe after this meeting, we'll all receive an alert on our phones is that your heart attack risk goes up. And if you swipe this alert away again and again like we always do, and it will eventually turn red and turn big, and our professional will call you directly. So that's our team think about what the future healthcare will look like. It will be more personal, emotional, and interact just with you. So that's the thing our team is trying to do. We hope that it can make more sense to our patients and boost their engagement in their own health. But it cannot be easy because of the like the data accuracy we're doing in the real-time analysis and the data privacy. That's a big issue. So can you talk more about that?
Absolutely, and you're right. So as the lead analyst for our data governance team, we know that HIPAA protects patients' health information and anything that might identify the patient directly or indirectly. So be it something on the medical chart, billing records, or a medical image, or any sort of data on their EHR. So with third parties like Cardiogram and their DPART app, there's a risk that the medical institution is going to have to take by just letting the Cardiogram research team getting data from the patient from a medical institution. So the risk here would be sending personal health information to a third party who could potentially have a security breach in the future, or have an employee that mishandles the data and allow it to be published on a public forum. And that's going to cause HIPAA guideline violations right there, and also ethical violations right there, just allowing the patient's information to be publicly on a public forum. So one way to circumvent this would be to enter a business associate agreement with between the medical institution and Cardiogram. This way, Cardiogram will be allowed to use personal health information to an extent while they operate on a secure connection that's going to be set by the medical institution. And so it's all going to be on the medical institution guidelines right there. So there's still the risk that Cardiogram, though, could potentially sell their data if they undergo a corporate restructure or if they liquidate all their assets due to bankruptcy. And This harkens back to Radio Shack, who liquidated all their assets and because of a bankruptcy, and nearly sold the information of 100 million customers. So things like their birth dates, their telephone numbers, and social security, they were going to sell all that information. But the FTC came in and blocked that. So you can see that HIPAA's designed to prevent this from happening in the first place. Before all the liquidating of assets, we want to make sure that if we enter an agreement with you, you're not going to sell the data under any circumstance. So the key question here is, what kind of data does Cardiogram need from a medical institution, if any, and are they willing to change their privacy policies to make sure that the data that they get from us isn't going to be sold down the line or sold to a third party down the line? So from a data governance side of things, we need to examine the possibility of also entering a data use agreement. So if research is going to be collaborative between the medical institution and Cardiogram, we need to make sure that the data that is passed back and forth is going to be governed. So before any data is shared, both parties need to figure out what data is going to be necessary for the research, how to limit the use of personal health information, and how is this data going to be accessed and stored. So when I worked for Wells Fargo, our data governance team at the time ordered us all to remove any sort of PIIs, personal identifiable information, from our data sets, and put that all on one big data set, which is going to be locked down. And if anyone needs access to it, they have to get the proper requests made so they can get access to it. And this is all just designed to make sure that no one's misusing the data. And if an audit comes down, we can track down who's using the data, what teams are using the data, and most importantly, who gave the permission for the person to access the data in the first place. And again, this is just to make sure that no one's misusing the data and allowing it to be breached in any sort of way. So the key questions here will be, is the research going to be collaborative? How's the data going to be stored and accessed, and how's it going to be safeguarded past just a medical institution providing a safe connection? And also, will Cardiogram be willing to remove personal identifiable information from their data sets and put on one data set that's going to be locked down and monitored over time? And, I know we've said a lot, but I want to make sure that we all get our main points across. So what's the main points that everyone wants to get across here?
Well, I just want to point out that the technology such as DPART will deeply decrease in hospitalization stays and will be great for both the patient and the provider.
Yeah, and I think that, again, using these kind of mobile platforms like DPART, being able to engage the patients is going to help providers on the clinical setting prevent things like medication errors.
So additional to our traditional services like provide home care and consulting, our team is going to develop the applications which will send intelligent and smart alert to our patients to boost their engagement in their own health.
And from a privacy standpoint, we need to make sure that a third party enters into a business associate agreement with us and also a data use agreement so that we can monitor the data that they're using and the data that they have access to. So make sure that none of this gets breached in any sort of way.
Great. I think that was a good meeting. Thank you all for coming.
Thank you for all for
Thank you.
coming.
Yeah.